AM 1450, FM 99.3, KNSI. Welcome back to Your Health. Produced in association with CentraCare. And today's guest expert, Dr. Jay-Sheree Allen, and we are talking fall allergies. First of all, Dr. Allen, it is great to see you again. How have you been?
Oh, thank you, Bob. Thanks for having me back. I've been doing well. It's just ironic we're talking about allergies today, and I'm here battling them myself.
Well, we are, in fact, talking allergies. We're going to talk about the cause of allergies, what they are, the symptoms, of course, and what can be done to prevent allergies. Well, let's go with the first question, Captain Obvious. What are allergies?
So allergies are your body's reactions to substances that are usually harmless, right? So with allergies, your body sees a substance as a harmful foreign object, and your immune system starts to overreact to it, right? From different objects, right? So we talk about things like pollen, right, which is really common, and small particles from grass and weeds and trees, that sort of thing. Mold. And I know everyone thinks of mold with the mold in your basement or growing, but think also of leaves, those fall leaves that you kind of have just laying around, really moist environment where mold can grow too. So we're not just talking about basement.
In the springtime, we think about snow mold, and the exact same thing happens. You're out there working in the yard, and this snow mold, the spores and all that stuff whipping around, right?
Yep. You don't want things laying around that have a moist environment to grow these spores that are going to cause this allergic reaction for some people.
Okay, so we're all pretty much familiar with the sliver and the finger kind of thing, that reaction, but the symptoms of allergies, stuffy nose?
Stuffy nose, like myself here today. Sneezing, the itchy, watery eyes, those really get people. The swelling sometimes of eyelids. The hives that we talk about with the skin, right? So these raised, red, kind of itchy patches on the skin. Some people get rashes, actually. Some people just itch.
Do you get a rash from airborne allergies, or does that have to be playing in the grass, that kind of thing?
No. So different things affect people in different ways, but that's typically contact. So something that's touched your skin.
Okay.
That will give that.
All right. Now, the allergies, the effect that these allergens have on us, you mentioned, nasal things, that kind of stuff. Quick question for you, and this is a personal note. My wife and I both wake up in the morning. Before we get out of bed, we're perfect. Everything is fine. We're breathing and all that stuff. My gosh, within 5 minutes walking around, we just slam shut, right? Nose starts running. You got the post-nasal drip going on.
Yep.
Is that an allergy kind of thing or no?
Absolutely.
Really?
That is. Yeah. So you'll hear the term allergic rhinitis that your doctor may talk about a lot. Yep. That is absolutely those allergies at work. The minute you get up in the morning, you start moving around the house, you're upsetting dust that's been sitting around. Another thing we don't think about, the filters in your homes and in your
furnace
cars.
filters,
yes.
Cabin air filters.
Yes, those are very important. I think we disregard that a little. And then too, just stuff that has things on it, right? You think about dust mites, and just dust laying around. I think we don't realize how significant those things are when it comes on to allergies.
Well, and there are some other things that I think people don't really realize. That is, I just put new carpet in my house, right?
Yes.
You've got all those plastics and all those man-made fibers that we may not be able to tolerate.
Yes. And another thing with the carpets, make sure you're vacuuming them, right? Frequently, too. Yeah. And washing those bed sheets, anything that's accumulating like dust or particles of dead skin, that's really important.
When it comes to these symptoms of allergies, so I know I'm normal now because it runs just the same cycle every day, right?
Yep.
You have to start blowing your nose, then I start sneezing. So as I'm sneezing, I'm just wondering about the whole process of the body. When I sneeze, does that get rid of those allergens? When I blow my nose, do they all go out of my nasal passages into that gob of yuck in my hand?
Not all, right? Because then it keeps happening over and over again. But what's really important, you do want to ensure that you're employing really good hand hygiene when you are sneezing, because you are releasing viral. If you have a viral upper respiratory infection with that, a lot of times these things coexist. Right? So you don't want to sneeze into open air or sneeze in your hand. You want to sneeze into a tissue,
Right.
or sometimes we say even in the elbow if there's no tissue around, because you do transmit particles that you can transfer to other people, and you don't want to do that if you also have a viral infection.
Yep. It's one thing, right, to be in your house, in your own home, and you know what's going on. But when you're out into a public place, that is when you really need to be careful. And have you noticed that people sure seem to be sneezing into their elbows?
I do
or coughing
see a lot
into their
of
elbows.
people sneezing and coughing into their elbows. I'd rather them do that than just cough out loud. But
Right.
it's a really good time of year to just have a little packet of tissues with you.
When you do sneeze or cough into the atmosphere, we've seen those pictures, right? Do you know how fast those projectiles are? It's unbelievable. So when you do that kind of stuff, and let's say you're at a gymnasium filled with kids playing a basketball game or something, or you're at a choir concert or what have you, know that you're not alone and that all of those germs are in the air.
Yes. And also remember, if you're coughing and sneezing into your hand, you open doors, right? You touch knobs, you touch surfaces, and that too can transmit the virus particles.
Dr. Jay-Sheree Allen is with us, and it sounds to me like we should be all wearing hazmat suits.
No, I don't think that's practical, but what we can all be doing is washing our hands. At least 20 seconds. They say the happy birthday song.
Sure.
You should finish the whole song with soap and water, or you can use an alcohol-based sanitizer.
Now, I talked to a
do the
doctor
trick.
once about washing your hands and the importance of soap and how the whole thing works, right? And the first thing out of his mouth was, Bob, we clearly can't wash our hands with boiling water, which is what it would take, right? So when you are using soap, and it doesn't even have to be antibacterial soap, it helps. But if it's just regular soap, how does that get rid of things?
You need to rub. You need to rub the hands together. You need to get behind the hands. I think we think about our palms, and we just kind of rub our palms together
and
2 or
that's
3
it, right?
times.
20
and that's
seconds.
it.
See you later. Bye.
Yeah, right? No, you need to rub those hands together. You need to get behind the hands, get in between, right, the fingers. And another thing that I think people really overlook, then you're done washing your hands and you use your clean hand to turn off the public bathroom sink.
Yeah, or maybe you have, maybe it's one of those places that still actually has a paper towel.
Yes.
Right? And you can use that. I do that all the time here when it comes time to turn off the water, and then when it comes time to open the door.
Grab that paper towel, absolutely, and use that paper towel. Have you noticed that in a lot of bathrooms now, there's a little dustbin by the door?
Yes.
Because they now realize that we're using the paper towel to open the door.
But I thought these Dyson doodads, these air dryers, are supposed to be the thing.
Well, they're environmentally friendly,
Yes.
right? So we're not having paper.
Right.
But I think paper does have its benefits.
Yeah, and most of the reports that I've read is, it's a great idea to have these air dryers, but guess what? They're blowing around all over the place in the bathroom. All the germs that's on you. Exactly right. AM 1450, FM 99.3, KNSI. It is fall. It is time to talk about fall allergies, which is why Dr. Jay-Sheree Allen is in studio with us. So we've talked about what they are, what causes them. We've talked about some of the symptoms. We're going to keep going, and we may even find out what we can do to prevent allergies. Stay with us. You are listening to Your Health on KNSI. AM 1450, FM 99.3, KNSI. You are listening to Your Health. Our special guest expert in the studio today, Dr. Jay-Sheree Allen. Literally, you're going to see kids from 9 to 92 coming in with fall allergy symptoms, right?
Oh, yes.
Do allergies affect little kids more than middle kids or older kids, or is it all the same?
In my practice, I've seen them all the same at this point in time. I've seen them all the same. But the season is what changes things.
Well, let's talk about that, because am I imagining things, or do the fall allergies seem... I know they affect me more than the springtime, but am I in the norm or not?
You are not making that up at all. Actually, 75% of people allergic to spring plants have reactions in the fall, particularly to ragweed.
Okay.
So that's our problem in the fall. It's ragweed. So believe it or not, it's the biggest trigger for allergies in the fall. So even though it starts releasing its pollen, I think it's in like late August
Okay.
or so, when it's like a little warmer. It can last like into September and October. And ragweed pollen travels hundreds of miles.
Yeah, it gets up there in the atmosphere,
wind.
doesn't it?
Yes. So even if you live in a place where you're like, but there's no ragweed around me, it travels hundreds of miles. Like, that was actually quite new for me to learn. So, yeah.
What if I move hundreds of miles away? For example, perfect case in point. Oh, and we're going to get back to these worst, these. In fact, let's do that. Let's go through the worst allergens. Who are the most offending culprits out there other than ragweed?
So in the fall, number one is ragweed, and by far.
Yep.
Believe it or not, number two is actually mold in the fall.
Okay.
And this is the mold that I'm talking about with those leaves that are laying around, right? But in addition to ragweed, there are some other culprits in the weed and trees department. So we'll talk about those a little bit. So a couple names, sagebrush, pigweed, tumbleweed, Russian thistle, cockleblur, burning bush, lamb's quarter. Have you heard of some of these?
Oh, absolutely, absolutely. Yep. Another word you mentioned cockleburr. They're at every farm, everywhere, right? You mentioned the burning weed nettles. I think is another name for those, right? And
mugwort.
Yeah.
Have you heard of that?
I don't know about that one. No.
Yeah, I was digging. I'm like, yep. So it's not just ragweed. So it depends on what's prevalent, too, around where you're living.
Okay, in the springtime, and again, we're talking about fall allergens now and fall allergies, but in the springtime, we go out there, right, and we're turning over dirt in the garden and we're releasing more stuff out there. How about now? I mean, it's harvest season, right? We're going to get out there, we're going to harvest the crops, then we're going to plow, then we may disc or whatever. Are we going to do the same thing? And when we're turning over the dirt for our gardens, aren't we doing the same thing that we do in the spring?
Some of that, but also remember the air is really moist too. And so remember, ragweed is one thing, but we've also talked about the mold. That's actually the second biggest problem in the fall time. So not the pollen that you're thinking of for springtime, but for the mold that you're not thinking about.
It's
these
different.
Leaves, it's a different thing.
Sure.
Yeah.
Now, I always heard that if it rains, the rain washes the allergens out, particularly maybe in the spring and summer. But I'm not buying it anymore because after a rainstorm, I've gone outside and they slam shut right away.
That's so funny because now you're creating these moist pockets, right, after your rain is done to cultivate the growth of things like these molds that you're reacting to.
All right. Now, what if I move across the country? For example, I moved from Rochester, Minnesota to Bismarck, North Dakota. When I was in Rochester, I would swear that I did not have near the allergy problems that I did once I moved to central North Dakota. Is that true, or am I just making stuff up in my own mind?
No, you are not making that up at all. But you have to think about what are you allergic to, right? So allergens are different for different people, right? The exposures around you are also different, right?
Do we grow into that stuff as we get older? No allergens as a kid never bothered me at all. I grew up on a farm.
Varies, but also have you heard of kids who've had allergies, things they were allergic to when they were younger, and then as they're older, now it doesn't bother them too much.
I've heard the same,
Yeah, so it can go both ways.
Both ways.
Yeah, it can
Very
go both
good.
ways. I think another thing we forgot too, with the fall, that's really, really big, dust mites. So they're more common in like the humid summer months, but I think we forget about like when the first time you turn your heat on in the fall. Yep, that triggers all that sneezing, the wheezing, the runny nose. I think we completely disregard that one, too.
Well, I think you just also illustrated the importance of cleaning out the ductwork.
Yes.
Right?
And changing those filters.
You know, we haven't even mentioned dogs and cats and that kind of stuff that are trapped in our house with us. Right?
Yes. So that's where your vacuuming comes in handy, washing your sheets come in quite handy, like that's where you've got to employ that kind of stuff. But that's going to be an all year round task for those people.
So think about this. You're outside, you're working in the fall, you know, it's time to do the fall cleanup and all that stuff, which everybody's just starting or else in the middle of it, right? So, oh gosh, I worked until 7:30, 8 o'clock. I grab a bite to dinner and I go straight to bed. Guess what I'm bringing into my bedclothes with all of the other things? Allergens, right?
Yes. All of those things that you were outside working with are now inside the home with you. You will not have a fun morning when you wake up.
What's some best practices there? Take a shower before you go to bed?
Please take a shower. So take your shoes off at the door, right? Take the shoes off at the door and take a shower. Change the clothing you're wearing outside before you get inside your bed.
All right. We need to talk about the diagnoses. We need to talk about the treatment, over-the-counter medicines, all that kind of stuff. One more question before we get to that. I leave the radio station. I get into my car, and I'm driving a 15-minute drive anywhere in central Minnesota in your home, right? I get about halfway home, and boom, the same thing happens. But if I'm not going home, if I'm going away from where I live, am I allergic to my wife? Is that the deal?
I did not
she's
say
pleading the fifth right there.
one.
No, but if you are literally driving down the road, you can really feel that, can't you?
Yes, no, definitely. I mean, because your car, the air is on in your car, right?
Sure.
So you've got to change your filter. You know, I had my car, I got my car inspection recently, and looking at the filter, they actually pulled it out and showed it to me.
Right.
I couldn't believe that I was breathing all that in every day.
And when they ask you, hey, should we change your cabin air filter in your car, the answer has to be yes. Absolutely.
Say yes.
All right. Dr. Jay-Sheree Allen is our guest. Allergies and allergens, the topic for conversation. We're going to get to the cure, or at least for the treatment, so we'll all feel better in just a moment. You are listening to Your Health, AM 1450, FM 99.3, KNSI. AM 1450, FM 99.3, KNSI. Grab something right on, folks, because this is information you need to know. We're talking about allergens and allergies and relief. Dr. Jay-Sheree Allen is with us. Diagnosis. How do we diagnose what the particular allergen happens to be that's causing my symptoms?
Yeah. So when you go in and see your physician, tell them the story of your allergies, right? When did these symptoms start? Exactly what it is that you were around, right? Those are really important. That's what we call a history. Honestly, we can make a diagnosis most times just from the history, the information that you provide us. You're going to tell us about the sneezing and the coughing and the runny, itchy nose and eyes, right? So that is very helpful. I think we underestimate the power of that. Everything doesn't need a test, but we do have some tests if we need them.
Do most people, if they're dealing with allergies, do they come to see their doctor, or do they just run into the pharmacy?
Most people run into the pharmacy. So we're going to talk about some of the things you could pick up in the pharmacy too.
Well, let's go there. What when it comes to treating allergies, what do you recommend, doctor?
So couple major things. One, we talk about decongestants, right? And so we won't promote any particular brands.
You
but
can if you want to. That's okay. No, really.
No, they all say them on the boxes. They all have different brands, but they will all say that they're a decongestant. That's most important. So the way that works, it helps to reduce the swelling in your nose and your sinuses. So they'll also lessen like the amount of mucus that's made by your nose. So that's when you'll notice you start to like really blow your nose and some stuff really starts to come out when you start taking those decongestants.
And you'll also notice your head doesn't feel like it's going to explode anymore, right?
Yep.
Wow.
So that's the big one. The next one, antihistamines. Okay. So I think we all know these. The brands out there, again, not promoting any particular brand, but the popular one, the Zyrtecs and the Claritins and the Allegras, right? Those block the effect of histamine. And so histamine is a chemical that your body makes when you have an allergic reaction to something. But these antihistamines will help to stop this, like sneezing and the sniffling and the itching and that sort of thing. But I think totally unrelated to your immune system, histamine is also produced in the brain, where it plays a part in you feeling awake. So antihistamines used to treat like respiratory symptoms can get into the brain and interrupt this. So you notice some antihistamines make you very drowsy or like put you to sleep.
Yes.
So you want to be very careful with that and take these at night. Some are less sedating than others.
And in fact, they have non-drowsy variations, right?
You will see them put that on the box. So that's a very important distinction because you got to go to work.
Alrighty. Are there underlying health conditions that we should be aware of before we go to the pharmacy and just load up on this stuff? Like,
yes,
what can we harm ourselves?
You absolutely can harm yourself, right? So the first things first, if you do go to the pharmacy, you're a relatively healthy person, you recognize this is a seasonal thing, right? And you go to the pharmacy, you shouldn't be taking these for more than 3 days. Once you hit that 3-day mark,
really?
You shouldn't keep taking these medications forever and ever on your own.
I've never heard that.
Yeah, that's really important. Please, like, seek the help of a professional. If more than 3 days, you absolutely need to keep doing all this stuff. But if you have issues with your lungs, right? You have asthma, you have COPD, emphysema, right? You have cardiac conditions, so you're on quite a few medications for your heart, right? This is really, really important to talk to your doctor first before starting some of these medications.
Okay, I love pharmacists. They literally are the last line of defense, right?
Yep.
Listen, everything these days is computerized and all that stuff. So if you're going to prescribe something, you're going to pull it up and, I better not do this one. I better. Here's one that will work, right? So then you get that prescription. You go to the pharmacy and you talk to your pharmacist one more time. Do the same thing before you just grab some over-the-counter stuff, right? Talk to your pharmacist.
Yes, ensure that it's safe for you to take these medications. Other things to think of, like people with high blood pressure, right? These are really common conditions. Another big one I've got to throw in there, nasal steroid sprays. Okay. So this is like the Flonase that everyone hears about, right? Sure. So that's really helpful. It reduces that irritation and the swelling in the nose and in the sinuses. That will help to decrease some of this swelling, which is causing some of this inflammation.
Sure. There's medicine in that, though, right?
Yes, it's a steroid.
Sure. What about the non-steroid, like just salt water, right?
Yes,
saline
the saline
spray?
rinse. Those are awesome. And they even have them now with the jets that you can squeeze it down and it pressures the water out for you. So while you're doing that, you're blowing your nose at the same time. Works like a charm.
Are you a neti pot fan?
No, I do the jet, but neti pots do work too.
Okay.
But I do the nasal saline rinse, and there's a little button at the top, and you just press it, and it shoots it out like a jet.
That's what I use, and it really, really works.
I've been on it this morning.
Very good, very good. Are there any other things that we should keep in mind? I know that off the air we talked about, what about plastic covers and that kind of stuff?
Yeah, that's important too. So the reason for that is to protect against the dust and the mold from building up on the mattresses and on your pillows. If you're going out and doing yard work or house cleaning and you're susceptible to this stuff, put a mask on. Oh, sure. Totally fine to put a mask on. The vacuuming we spoke about, try to keep the pets off the bed if this is a big thing for you, if it's a big problem for you. Washing your hand is really, really important.
Probably number one, don't you think?
Yes. I remember we talked about soap and water, at least 20 seconds. And then, honestly, you may have to keep these doors and windows shut during this season. It passes. Yeah.
And your kids, they'll tell you to.
Yeah.
Yeah, exactly right. Dr. Jay-Sheree Allen, our special guest again today. Thank you so much for helping us battle the allergens again. Appreciate it.
Thank you.
AM 1450, FM 99.3, KNSI. You have been listening to Your Health.